Hello everyone and welcome to tonight's webinar on the Digital Health Guide. Thank you for taking the time to be here this evening with us. So my name is Aya. I am the Digital Health Coordinator at Sydney North Health Network, and also presenting with me tonight is Tim Blake, who is the Managing Director of the Digital Health Guide. Managing Director of Semantic Consulting. So before we get started, I just wish to acknowledge Australia's Aboriginal people as the custodians of this land. We pay respect and recognise their unique cultures and customs and honour their elders past, present and future, and extend that respect to Aboriginal people attending tonight. So just going through some housekeeping items. So your microphone and video will be disabled during this webinar. We would love to hear from you tonight, so please only use the Q&A option at the bottom of your screen to ask any questions or even just send any comments that you may have for Tim or myself. If you do see a question that is of interest of you, feel free to give that a thumbs up as well, because that will move the question up further up in the queue. We will also do our best to answer all your questions tonight live during the presentation. It is also possible for you to interact with each other using the chat function if you'd like. And if for some reason your screen freezes, your Wi-Fi connection may be limited, so probably just try moving a little closer to your Wi-Fi router. And lastly, at the end of the webinar, please complete the short evaluation survey, which will also be emailed to you tomorrow. So just before I do hand over to Tim, I'd just like to, inform you a bit about what the digital health team at Sydney North Health Network do and how we may support you and your practice. So we offer support to health services and healthcare professionals just like yourself relating to digital health systems. Some of them listed just below here. So some of the solutions that we provide support and training with include telehealth. So we are continuing to support practices register with Health Direct Video Call, which is a free platform you can use to conduct telehealth consultations with your patients. And it also has really great features and tools that you can utilise during your consultation. So things like sharing documents or YouTube videos to demonstrate how to do an exercise or to take a certain medication, let's say an inhaler. So if you would like to access the platform, feel free to contact us on our email below there. We also provide support with the My Health Record, which is basically an online summary of your patient's key health information. So things such as medications, test results, hospital discharge summaries. So we can help you get connected and provide you training on how you can use the system as well. And we also provide support with secure messaging, the digital health guide and electronic prescriptions. So just a little note with electronic prescriptions, we now have more than 50% of pharmacies in our region enabled for electronic prescriptions. So if you're joining in and you're a pharmacist or a GP and would like to enable your practice for electronic prescriptions or prescribing, please feel free to contact us as well on digitalhealth@snhn.org.au, and we will get back to you and organise a time to provide you with that support as well. So welcome to anyone who has just joined, and I'll now hand over to Tim for this evening's presentation. Thank you.
Thanks, Aya, and I trust that you can hear me okay?
Yes.
Very good. Okay. So as Aya said, my name is Tim Blake and I'm the Managing Director of Semantic Consulting. We're the organisation responsible for the Digital Health Guide. And in the session tonight, I'm hoping to spend about 15 minutes just telling you the story of how the Digital Health Guide came about and what it seeks to achieve and where we're taking that, and then spend about 20 to 25 minutes giving you a demo. Please feel free to interject with questions as we go, and Aya will monitor those questions, and if relevant, Aya, feel free to interrupt and read them out. We'll also have time for questions at the end if there are things that you want to explore. So my organisation is responsible for working with a number of organisations in healthcare particularly primary health organisations, community health organisations, and allied health organisations. And as part of the work that we do, we look at new technologies and the way that they can be applied to help engage patients, to drive health literacy, to increase accessibility and equity in the delivery of healthcare, and to create new models of care using new digital technologies. And increasingly over the last few years, this somewhat thorny subject of mobile health apps has come up again and again. And if I go back about 3 or 4 years, my organisation was developing a digital health strategy for Primary Health Tasmania, the PHN down in Tasmania. And as part of that digital health strategy development, we had a number of GPs come to us saying, we're actually starting to get patients coming into our practice at the engaged end of our patients, but nevertheless, we're getting real patients come into our practice saying, doctor, I'm using this mobile health app. What do you think? Is this any good? Should I be using something different? And the GP said to us, look, we really want to guide our patients. We want to give them good advice, but we don't have that information at our fingertips in the same way we do with, say, medications information, where we can go and look at our MIMS book or online resource and look up things that we don't know off by heart. We don't have a source of information like that. Can you please help us? And initially the request to us was, well, do you have a list of certified mobile health apps? Literally, do you have a Word document or a PDF? And we said, look, not really. That's arguably, it's not our job to do certification as a healthcare consulting organisation. That would be a national regulatory role, and we can talk a little bit about where that's heading nationally now as we go through the presentation. And neither do you really want a list, because this is changing on such a regular basis. You know, new apps are being introduced all the time. And it turns out, as you'll see on my slide here, there are currently well over 300,000 health and medical apps across the Apple and Android app stores, which can be, frankly, overwhelming for people. But nevertheless, these GPs wanted some help, and we said, why don't we try and help you as part of this digital health strategy? And from that, started a website which was an online resource to look up information about apps, and it has since grown to become the Digital Health Guide, which is an IT solution in its own right that helps you to discover classified details of, classified in the sense of into different schemes of what type of app and what conditions they're for and what functionality they have. You can discover apps, you can look up information about the quality of those apps, you can find evidence for the efficacy of those apps where it exists, and you can also safely prescribe those apps or recommend those apps to your patients. So it's become a resource that over 8,000 medical professionals in Australia now use, and help them navigate this complex space of apps where, frankly, a small proportion of them are incredibly helpful and have the potential to significantly transform the health system. A large number are awaiting evidence of their efficacy, and some will achieve that and many won't. And a reasonable number of them also are quite unhelpful, and some in fact are downright dangerous in a space that is frankly under-regulated, and regulators are very behind in regulating this space. And our organisation has been responsible for reporting a number of apps to the Apple App Store, for example, where those apps are using techniques that are just downright clinically unsafe. And that, in a sense, should be a little concerning in that the regulator is not necessarily doing this job itself. So we can talk a bit about that, and if there are questions, I'm happy to take questions on that as well. There are some plans for developing evaluation frameworks and certification frameworks, and there's recently been released by the Safety and Quality Commission a new framework for self-assessment around digital health, mental health resources. And again, we could talk about that if anyone has any particular questions. But nevertheless, this space remains largely unregulated. And in that gap, we've sought to provide high quality information so that clinicians can make good judgments about apps that are good and have evidence, and apps that are clearly dangerous and don't. So that's really the space that the Digital Health Guide is trying to occupy. This slide comes from the most recent RACGP technology survey, which is about 18 months old now, and backs up the fact that a sizable proportion of GPs are making app recommendations or other digital health solution recommendations to their patients. Now, the numbers in this survey, which has been run annually, typically by the RACGP, have gone up and down. And the previous year to this, they suggested it was about 50%. This year, they suggested it was 25%. Whatever the reality is, a decent proportion of GPs are making these recommendations. Arguably an equal or larger number don't, but nevertheless, there's a material number of clinicians who are engaging with patients on the issue of mobile health apps. And our experience, albeit anecdotal, but on a reasonably large scale, is that these categories are the main categories of apps which are recommended. So particularly apps for mental health, where there is a good and growing evidence base for a number of the techniques used in apps, particularly things like cognitive behavioral therapies, where a significant evidence base shows that app interventions are as good as face-to-face interventions. Physical exercise or fitness apps are also very popular, many of which use elements of gamification and other behavioural modifications, and many patients would attest to the and give testimony to the difference that they've made in their lives, and I'm certainly one of those engaged patients, and happy to talk about some of those examples. Nutrition apps are often taking the place of the traditional kind of paper-based food diaries for patients with different conditions, although great care should be taken in this space because there is a lot of quackery. And family planning, or we'd probably characterise this more as women's health, but again, a lot of apps, some of which are very good and some of which you have to be very wary of. This screenshot comes from the same survey, the RACGP Technology Survey of 2018. And again, down the centre, I think reinforces some of the reasons I've given as to why clinicians have traditionally found it hard to recommend apps, because they have a lack of knowledge about what is effective. They don't have a trustworthy source of what is effective, and they particularly don't have that at their fingertips in the same way they would, like I said, with medication data or MIMS data, that you can just look up something that's indicated for a particular condition, for example. There are concerns in some quarters about patient digital literacy, but I'd have to say that's not been an issue we've crossed so much. There are a large number of patients who are doing this. The challenge is more whether the patients are using the right things and whether we can guide their self-efficacy in the right directions. It's worth noting on the right-hand side that GPs would recommend health apps more often if there was that trusted source of app advice, and that's certainly a space that the Digital Health Guide has tried to fill. And we have worked and we continue to work with different professional colleges to look at their willingness to endorse particular apps, although that willingness so far has been relatively low. We do carry some endorsements on some apps. I think also it's worth noting that there are apps for clinician use as well. So clinical calculators, therapeutic guidelines, medicines information, and a number of other things are available in app form, so that if you are somebody who does community visits or after hours, some of the things that might traditionally be available on your desktop are also available for you. And the Digital Health Guide makes a point of offering resources that can be looked up not just for patients, but also for health providers as well. So, as I said, our estimate is that somewhere between 25 to 65% of Australian GPs are recommending digital solutions to patients. And when we say digital solutions, that encompasses more than just apps. The Digital Health Guide is predominantly information about apps, But also many of the things we have in there are not apps, they're just web-based solutions. So that's why we use this language of digital health solutions. Some of them come in an app flavor, some of them come exclusively in an app flavor, others come just in a web flavor, and some of them have both. And as we've spoken with different health systems, what comes to mind here particularly is Queensland Health, where we had a workshop with some of the most senior clinicians across the state. A number of them have come to the realisation that clinicians are making recommendations. Queensland Health estimated about 30% of their clinicians were making digital recommendations, but some of those recommendations risk being made, and I'm not saying anyone on this call is doing this, but we've certainly seen this. Some of those recommendations are being made based on personal preference, not on evidence of efficacy or on some kind of safety and quality framework. They're not necessarily based on organisational endorsement, they're based on personal preference. And that's problematic because I have now presented the Digital Health Guide face-to-face to over 500 clinicians. We've heard a lot of different stories. And at one end of the spectrum, we've heard a number of clinicians tell us, I used this app, I liked it myself, and so I recommend it to patients. And you can see that whilst in one sense that might be okay, it also carries a degree of risk where something is not necessarily proven and your testing has been anecdotal and not necessarily comprehensive. On the other end of the spectrum, we've met clinicians who say until there are gold standard RCT trials that prove efficacy, then we're not going to make recommendations. And those are both valid perspectives, I guess. We're not here to tell people that they're wrong, but we probably would take a position somewhere in the middle that says it's quite possible to look at some of the emerging evidence base for some of these apps and to make confident recommendations on the basis of where that's at and where that evidence is at for a number of apps as they stand today. And that evidence base is growing quite rapidly. The other risk with making informal recommendations is we found, again, anecdotally, that clinicians are often making the recommendations on a post-it note or in an email or even verbally and not keeping a formal record of what they have recommended. And again, medico-legally, that seems to pose a risk. So the Digital Health Guide has stepped into that space by providing you with a way to track what you have prescribed to whom, when you did it, and why you did it, most importantly. So leaving yourself a good clinical record of why you made a particular prescription, what it was for, and on what basis you made that. There's also a huge, in that crowded space of 300,000 things, there's a large number of apps that share the same name. So there is a real risk if you're just making a verbal recommendation that a patient goes and finds the wrong resource. And so therefore that's something that needs to be considered as well, so that you're not generating medico-legal liability and yet still are happy to work in this space where many patients are already off exploring regardless of the advice that we may or may not have given them. So fundamentally, the Digital Health Guide exists to help health providers develop trust in high quality digital health solutions, and also to discover when solutions are poor quality and to propagate the knowledge about that as well, and to promote an evidence-based approach to the use of digital health, really trying to close that gap between engaged patients who are often running and health providers who traditionally haven't been equipped with the information to support those engaged patients. So to do that, we support three fundamental use cases. One is, as I described earlier, a patient comes in and says, I'm using this app already, what do you think? And we have the ability to quickly look up an app, see what it does, and to make a call, potentially even at the point of care, as to whether something is of sufficient quality for a patient to continue using it. Secondly, we have the ability to prescribe or recommend the use of mobile health apps that you trust. You won't necessarily find one at the point of care during an appointment. You can, the tool allows you to do that, but we think it's more likely that clinicians will build a pool of things that they trust over time as they review evidence and see patients using things. And we have the way to build up a list of favorites and put those favorites into groups. So you can prescribe things to individual patients, or you can prescribe things per condition, and I'll show you how to do that in a minute. Lastly, but not least, we have the ability to find mobile health apps for your own use as a health provider. And again, I'll show you how to do that via the search function. I'm not going to go through this in any detail because I've really discussed these things, but the kind of information that the Digital Health Guide covers, who made an app, how are they affiliated, what platforms does it work on, what conditions is it for, what functionality does it have, what age groups is it for, and then pricing, evidence, all of these kind of things, reviews and ratings. And then you can search by all of these types of information as well to quickly find something that matches the criteria that you might have. But I'll show how to do that, and I think it will be clearer when I do that. So we've had some positive press coverage. No particular comments about that, but just to say what we've done has had some profile, and as I said earlier, has been used by about 8,000 health providers across Australia. And we also have a growing degree of clinical endorsement, and on our website digitalhealthguide.com.au you can go and see a video, for example, by Dr. Liz Wern, a GP from the Gippsland region. So we do have clinicians willing to attest to the work that we've been doing. So I'm going to switch now and show you a demonstration. If you do have questions on the basis of the things I've said, some of which may well have raised questions, please do ask them in the Q&A. I'm very happy to address them as we go. Aya, just checking you can see my screen with the Digital Health Guide up here.
I can see
All
that.
good? Okay, excellent. So worth adding, and I presume most of you on the call know this, but you may not, that the PHN has purchased licenses on behalf of health providers so that it is free for you to use. The Digital Health Guide is free for GPs in the Sydney North region. So if you haven't already got those login details, please contact Aya afterwards and we'll make sure that you can log in. Once you've logged in by going to digitalhealthguide.com.au and clicking on login, putting in your details, this is the screen that you'll be brought to. And let me just walk you around what's here. There's some informational resources on the right-hand side. On the left-hand side, we have a browser that classifies the apps and other digital health solutions by condition. And if you so wish, you can click on the icon to the left, the Digital Health Guide icon, and see a full alphabetical list of all the nearly 1,000 resources that we have reviewed in here already. I'll explain what some of the icons mean in a minute. So one way to navigate this information is, for example, to click on a particular condition and scroll down and see, in the case of anxiety, a very large number of resources available for that. In terms of the icons here, the little certificate icon, if you hover over it, is showing you that some evidence has been found for that app. In the case of the triangle warning sign, there are some warnings on this app. And again, I'll show you what that means in a minute, but there are potentially some things you might want to check out that could be a problem in terms of that app. What we encourage people to do predominantly, though, is to use this search bar up the top. So I can start typing, and as I start typing, it will stop and predict things that I might be looking for. So I might be looking for a particular condition, or I might be looking for a solution by name. I could also type the name of any functionality I might be looking for. So for example, if I wanted an app that had medication management functionality, or used artificial intelligence, or used gamification, I can search for those tags as well. And if I search for more than one tag, it will find things that have both of those tags, and I'll show you that too. But for example, I could search for anxiety and gamification tags both together, and it will look for gamified anxiety apps. So we have a good way of beginning to do that search. But what I'm looking for right now is an app called Smiling Mind. So I'm going to type smiling. I'm going to select Smiling Mind, and I'm going to show you the entry for Smiling Mind. So what we can see here, the icon of the app, we can see the little certificate icon, which indicates that there is some evidence available for this app. we can see that this app was created in Australia. It comes from Australia. And if I wanted to, I could click on this link and it would take me off to the websites for Smiling Mind. I could also click on the different App Store links. And in the event that I wanted to go download those apps, that's obviously a bit more useful if you're on a mobile device, and it will automatically open the App Store for you and allow you to download it. We have also across the top here a summary of different ratings, and I'll explain when we get to the detailed content of that down the bottom. But essentially the meta rating is the overall average rating, and that's broken down by a number of sub ratings. So health provider is the score that health providers have given this app, or users of the digital health guide who are health providers. Other contributors are users of the digital health guide who are non-clinical. So people like myself who come from a health IT background, potentially practice managers, others who are not APRA registered health professionals. The App Store scores come from the different app stores, or an average score from those app stores. And the Digital Health Guide score is the score that our review team gives to this app. And I'll talk a bit more about those different perspectives when we get further down. We also have these review comments. We curate a couple of sentences of review comments. We keep it very brief so you can get a real succinct sense of what this solution is. So the intent is that you can quickly scan this information if you need to, even at the point of care during an appointment, to get a sense of what this app is and how good it is. You can see the last time that we have reviewed this app, this one back in May. It's still active, so it can still be downloaded, but there are apps in here that are no longer available for download, and yet patients may still have them on their mobile phone. So in some cases, we mark them as no longer active, meaning you can't download them. Alternative names tracks whether the app has changed name, because sometimes they do that, and it gives you a history of what the app was called previously. And update frequency, we track how often this app is actually updated. So if you have a patient you're discussing, how often might we, is it worth paying for this app, for example, then we can look at this and see whether that might be worth the money, particularly if a patient is stretching themselves to buy a particular subscription to an app. Apple don't publish information about number of downloads, but we do have the estimated number of Android installs, and in this case you can see over 500,000, which makes it a very popular app. If we wanted to, we could click on the privacy policy, and also we can see that this is a not-for-profit organisation, and for some people that makes a real difference. What you'll notice as we present this information is we're trying to present you with the information, but not make a strong value judgment about what that necessarily means. Yes, we do provide a review score as one of many, but we've noticed that different people weight this information in different ways, and they weight it in different ways in different contexts. So the intent here is that you can look at this information and determine whether it's appropriate for your patient given the context they're in. In some cases, a paid app might be good, in other cases, it might not. And sometimes it might be great that this is a not-for-profit organisation. In other cases, it might not matter that an organisation is a commercial for-profit organisation. So some of this information is presented so that you can make those judgments, not necessarily so that we are going to do that. In this case, you can see the app is free, and somewhat unusually, it doesn't have a subscription model, but donations to Smiling Mind are possible. We can also read the vendor's own description of the app that comes from the App Store, and you can see that it's a free mindfulness meditation app developed by psychologists and educators. And clearly that's something that will factor into our overall assessment about whether this is fit for purpose for the patient. We can see that this app is supported on Apple and on the Android platform. You can see the date that the last version was published, so you get a sense the app developer might be in maintaining this, and that can clearly be a factor in whether a patient's going to pay. And we can see various technical features. Now, the app stores won't give you this information. We have to get this from our review process, but we tell you whether the app can be password protected, which is clearly important to some people. We tell you whether it can work offline, again, really critical to patients who might be in more rural areas without constant network coverage. whether it stores data in the cloud and whether it integrates with the Apple Health ecosystem. Similarly, we publish a bunch of information about the target audience that is not there in the app stores, and you just can't get this information by a quick review. So this is really critical, and it allows people to search for this, search for apps based on this information. So, for example, we show whether this is for health consumers, for patients, and whether it's for providers. So in this case, this app is for patients, not for health providers. What capabilities does the app have? So in this case, it's for meditation and mindfulness. And if I hover over that, I'll get a bit more of a description of what we mean by that. If I click on that, the Digital Health Guide will now run a search for all of the other meditation and mindfulness apps that are available in the App Store. Sorry, I'm running off a slow internet connection here. So you can see that 65 results are found. So there are 65 apps in the Digital Health Guide for meditation and mindfulness. We can also see the conditions that this app is indicated for. And again, similarly, if I clicked on that tag, the Digital Health Guide would run a search for apps that are for that condition. And the same with age groups as well. I think where the rubber really hits the road is as we get down here, though. So what you can see is that we have found some evidence for the efficacy of this app. It doesn't necessarily tell you what this evidence says and whether it's strongly positive or not. But what you can do is hover over an individual piece of evidence and see the abstract without leaving the Digital Health Guide. So you can read this and look at the N numbers and the P numbers in a study and its results and make a determination of how good you think this evidence is. And if you want to, you can click on the link and it will take you off to the full text where that's available. In a few cases, that's behind a paywall, but in the vast majority of cases, we have full text available. Similarly, we have media information. So any high profile media events that occur in the life of this app or its vendor, we put in here so that you can see some of the trajectory of what this organization is achieving, some of the partnerships, maybe takeovers, funding for startups, any controversies that occur, we publish here. So you can go and look at some of that as you try and build your picture of what an app is like. In some cases, we have endorsements. So there are a few endorsements from the NHS, from the RACGP, from the FDA in one or two instances. But there aren't a large number of endorsements at this stage, but you can see them indicated here if they do exist. There'll be an icon of that particular organization, which you can click on, and that will take you to a page where that endorsement is explained. Last but not least is ratings and reviews. So as I explained before, the health provider score is all of the clinicians, the APRA registered health professionals who have reviewed this app within the Digital Health Guide. And what you're seeing here is some real GPs who reviewed this app, and it's averaged out at a 4.5 score. We do have some tips for writing reviews. And if you see in the bottom left-hand corner here, download review tips for health providers, you can see a one-page description of the do's and don'ts of writing reviews. There's no non-clinicians who have written a review for this. We do have some App Store scores that we've pulled in from the Apple iTunes Store and the Google Play Store, and you can see that. And then you can see the review that we've done as an organization behind the Digital Health Guide. And obviously some of these scores can vary, and they're intended to give different perspectives on the quality of the app. And what we've learned is that just having a single score, trying to make a single value judgment on the quality of an app is not necessarily entirely helpful. It really does depend on the perspective. So if you want to, you're welcome to kind of use the meta rating as a guiding light. But we have other people who care what we think or what patients think or what other health providers, their peers think. And the reality is we can use all of these scores to build a picture. And we have some apps where patients love them and health providers hate them, and vice versa. And the kind of conversation we've had with clinicians is that can be the start of a really good engaged conversation with a patient. if you have a patient who loves a particular app, but you can see that there's no evidence for it and the other health providers don't like it, maybe rather than just telling them it's crap and they have to move off it immediately, just gently guide them in the direction of something that might be better, rather than necessarily just telling them that they're wrong. So this is what's in a typical review for a given app. You are also free to write your own reviews. You can only write a single review for each app, but I could write and submit a particular score for this app. I can also, if I begin to find a set of things that I really like, I can hit the heart icon and it will save that to my favorites list. So I can build up over time a list of favorites that I then have a quick access to by clicking over here on the left. And this can be a quick way of giving this to a patient. I can, if I want to, print this out and give it to the patient that way. We've certainly seen some people do that. Or I can prescribe or recommend the solution to a patient by clicking on prescribe. I can type in the email address of a patient. I can potentially CC other health professionals or carers, and I can write, importantly, some notes on why I'm prescribing this to the patient. So as we said before, this will keep a record of who you prescribed to, when you prescribed, what you prescribed, and importantly, if you take a couple of minutes to write it, why you're prescribing this. And then medico-legally, that's giving you much better coverage in terms of the risk here. By default, that will be blind copied to your email, so the patient won't get your email address, and this prescription will come from the digital health guide. So that's really reducing the risk for you. The patient can't reply to the email, and you have a record in your email of the prescription that was made. You can then also, if you want to, copy this block of text, copy and paste it, back into your practice management system, medical director, best practice. So you have a record there as well, but you'll also have this in an email. The patient is then sent the prescription email, and it has a PDF attachment with all of the information, including all the links to the media and the evidence as well, so they can read those things for themselves. So a couple more things before I finish up and see if you guys have any questions, and I do hope there are some questions as we go. In addition, over here, you'll see these little warning icons. Let me pick one of these and show you. So this is an app, Flow Period and Ovulation Tracker is an app. You'll see at the top in a second, a big yellow warning sign. There was a Wall Street Journal investigation a year or two ago showing that some apps, and this is a particularly popular one, if you'll see down here, over 50 million downloads. In fact, I think in total across all platforms has been downloaded over 200 million times, was sharing information with Facebook, even though it said it wasn't in its privacy policy. So that caused a scandal along with a handful of other apps. And this is the kind of information that may trigger a warning. It could be there's a scandal, it could be that there's a security violation, it could be there's a privacy violation. In some instances, there are warnings from the TGA or FDA when an app has particular issues. And we just bring this to light and say to you, look, you may want to think about your ongoing use of this app in that context. So that's something to think about. So that's warnings. I want to show you what we call bundles. So in addition to prescribing or recommending a single app at a time, I can actually build what we call bundles. And a bundle is a group of digital resources that you might want to give to patients with a particular condition or set of conditions. In this case, we built a bundle for patients who are having mental health challenges because of social isolation due to COVID-19. So we have in here a meditation and mindfulness app, a journaling app, some formal MindSpot mental health resources, the government, Health Direct's COVID-19 symptom checker, and the government's coronavirus app. So if I hit prescribe on the bundle, I can then prescribe all of these things at once rather than just doing them one at a time. So I can build bundles that can be reused here. They're like groups of favorites. Just lastly, I want to show you searching. So if I start typing ANX for anxiety, I select anxiety, press return, the Digital Health Guide will now run a search for all the apps that are for anxiety. I think that's relatively straightforward. You can see that there are 96 of those. I can then potentially sort that list. So I could say, show me the one that has the highest number of installs, effectively the one that's been downloaded the most, the one that's the most popular. So of all the anxiety apps in the Digital Health Guide, this is the most downloaded of those. So that's an example of a very simple search. But as I said before, what we could also do is we could say, well, look, I want anxiety apps that have an element of gamification. This is the idea that if I turn it into a bit of a game, a competition that can engage people over a longer period of time, the act of competing or competing with friends or earning badges or whatever it is has been shown to be a good, at least short-term behavioural modifier. So this is going to show me all the anxiety apps that use gamification, and we can see here this time we have 9 different apps, so 9 gamified anxiety apps here. So that's good. We could potentially extend that search though. So if we click on the advanced search filter icon, what this allows us to do is to search on a much more granular level. So this time I'm going to say, I want anxiety apps, but do you know what? I only want ones that come from Australia. So the vendor has to come from Australia, and I want it to work on the Apple platform, because the patient sitting in front of me has an Apple device. So I want it to work on iOS. And you know what? I don't want any really bad ones. So I just want the ones that have a score of 3 or above. So Australian anxiety apps that work on an Apple device that have a score of 3 or over. So if I hit search, it's going to use all of that set of criteria across the structured information that we have in here to bring you back a list of things that meet those criteria. So you can see here, these are all the Australian anxiety apps with a score of 3 or above that work on iPhone. We could further narrow that down. So if I click on advanced search again, I could say, you know what, I actually only want things where there's some evidence for the efficacy of this app. So I'm going to bring back just a subset of what we just looked at. So it should be less than the 9 things. And we'll see in a second that, yes, there are 3 Australian anxiety apps for iPhone, a score of 3 or above, that have some kind of evidence. So again, here you can see we're using the search to narrow down what we're looking for. And potentially that could be used at the point of care with a patient to help determine exactly what it is that might suit them or what they might be looking for. It might also be a way of, in your own time, helping to build a list of favorites that are usable by you again and again. So I've pretty much reached the end of my demo there. Hey, I might hand back to you, see if we have any questions. And look, thank you everyone for your time. I really appreciate it. And as I said earlier, if you don't have your login details, please reach out to Aya and I'm sure she will help.
Certainly. Thank you, Tim. That was really great. Yeah, so as Tim mentioned, if you would like your login details sent to you, or if you would just like them resent to you, please feel free to email me on digitalhealth@snhn.org.au. We do encourage you to continue to ask your questions through the Q&A function there. And if we even have any Digital Health Guide users on tonight, we'd also love to hear from you, what your experience has been like, or if you have any comments. We do have one question, Tim, and that is what proportion of apps on the Digital Health Guide have evidence for their clinical efficacy? Yeah, look, that's a good question. So when we first started this journey, obviously that number was very small. So in the last 3 or 4 years, we've seen a real uptick in the rate at which evidence is coming through, particularly because producing high quality evidence, as you guys well know,
takes often a significant amount of time, and it can be quite problematic in the digital health world, where the life cycle of some apps, 3 or 4 years, it can take to do a high quality RCT. Some apps don't even last that long, will certainly have changed significantly in that time. But yeah, at this point, probably somewhere between 5 and 10% of apps have some kind of evidence. I think over time that will probably get to 20-25%, but obviously there's a sizable proportion that will probably never have evidence, partly because they're produced by small vendors who don't necessarily have the resources. There might, however, be evidence for the techniques that those vendors are using, but the number of apps where there's specific evidence for that app is currently 5 to 10%, and will probably grow, I think, to 20-25% over time.
Great, thank you for answering that. So we have another question come through from Linda. So good and growing evidence that apps are as good as face-to-face. So that's just a quote. Surely this depends on clinical judgment and what the patient wants. Some patients are seeking support and connection with a clinician, such as a psychologist. The relationship is supposedly key.
Yeah, look, and I need to clarify what I said. So I mean, I certainly wasn't saying that for all apps. That's certainly not the case, and that's certainly not proven. The context of the comment was in the context of cognitive behavioural therapies. Some studies have shown that cognitive behavioural therapies, when done right, can be as effective as face-to-face. That does not mean, and I'm certainly not advocating to use apps instead of face-to-face. I wouldn't advocate that at all, but it does mean that apps allow us to extend the accessibility of therapies to some people in regional and remote areas who don't easily have access to that, or who can't necessarily afford that. That apps have been useful extensions, but no, of course, it doesn't replace clinical relationship. None of what we're trying to do here is replace clinical relationship. In fact, quite the opposite. We're trying to arm clinicians with the information so that patients don't go off and do these things by themselves, and that you can have engaged relationships with patients. So I hope that clarifies it. We're certainly not recommending that or seeking that.
Great, thank you, Tim. So it doesn't look like we have any more questions come through, but please feel free to keep sending them through. I'll just gently remind you that to please complete the short evaluation survey, which will pop up at the end of the webinar. Your feedback is really important to us. If you have any other questions, please feel free to pop them in. Tim, do you have any final comments you'd like to add, probably before we wrap up?
No, just thank you for everyone's time. If you have any follow-up questions after this, very happy. You can reach me through the support email on the digitalhealthguide.com.au website, or through Aya. So thank you very much for your time.
Very welcome. Okay, well, thank you everyone for joining us. If we don't have any more questions, I guess it brings us to the conclusion of the webinar. So thank you again for joining us, and keep safe. Bye.
Thanks. Bye.